So, welcome to the session on community-based risk assessment, which is somewhere here. Anyway, just to make it look good. We are going to have 4 speakers today, and we've decided, as practitioners who like to discuss things with communities, we want to avoid just sort of the question-answer approach, but rather really have discussion. So we will, during the presentations, be collecting questions on cards, written questions, that the person in the orange shirt will be collecting. But make sure you get them in early, because we will address a few questions right after the presentations, but then we want to open it up for discussion. And we have a microphone set up in the middle of the room so that we can all hear what you're saying and all of your great thoughts can be shared with everyone. When we were meeting, sort of to get ready for this session, we realized we all felt a bit like strangers in a strange land. Here we are, sort of 4 people who are used to working really at the grassroots level with communities in the field, getting dirty and sweaty. And here in this beautiful building, hearing about all sorts of super high-tech things and really fancy stuff, and man, it's fantastic, but we felt a little out of place. So I can promise there's not going to be any fancy reports or fancy charts in this session. It's not going to be much academically challenging stuff to ponder about. It's going to be very simple and understandable. And in fact, in the Red Cross anyway, that's one of our main goals in how we work, is to keep it as simple as possible. But we believe with our simple approaches we have huge impacts, and we really are helping the most vulnerable people. To give an example of what this means in terms of programming, last year I did a survey across the whole Red Cross network, so 186 national societies. And on average, to do disaster risk reduction, we spend $5 per person per year. That's pretty cheap, and yet we're still pretty effective. So keeping it simple has a certain advantage in terms of cost effectiveness and getting impact. So, we've changed the order of presenters a bit compared to what's in the program. We're going to start with Nicole Williams, who's the Disaster Management Officer at the International Federation of Red Cross and Red Crescent Societies in the Caribbean. We'll then hear from Edmund Azarayan, anyway, I can't pronounce it, who is the Head of Disaster Management and Population Movement at the Armenian Red Cross Society. We'll then move on to hear from Manu Gupta, who is the co-founder and director of SEEDS in India, which is a Sustainable Environment and Ecological Development Society. And finally, we'll hear from Maya Asaf, who is the Humanitarian Emergency Affairs Manager at World Vision International in Lebanon. So, without any further ado, I'll pass the word over to Nicole.
Hi, I'm Nicole. I'm the Disaster Management Officer for the Red Cross Sub-Regional Office in the Caribbean. Our zone office is in Panama, and the English-speaking Caribbean support comes out of Port of Spain in Trinidad. That's it. There we go. The presentation's basically about some of the challenges we've had. For starters, when we began community disaster management in the Caribbean, about 15 to 20 years ago, we, having all graduated, decided that it would be an upstream, downstream, and we'd start with research papers, etc., etc. But we immediately ran into a wall in that to do research in the Caribbean, particularly for floods, you don't have data, or not very long data streams to be able to do projections from. So it's kind of spurious, some of the projections you do. So that presented a long timeline to delivering any sort of product. It's also been found that there is a lot of research done, but it's all sitting on shelves somewhere, in a ministry, in an engineering office, in a university somewhere, bits and pieces of data that everyone thinks is proprietary, and so we can't get our hands on it. So even if you wanted to do the research, you would have to start from scratch in many instances. Even if we produce the final product, the technical information doesn't translate very well. How do I explain to somebody the attenuation of a tsunami wave? And I think we had a whole session earlier today about the 1 in 100-year flood. These are difficult concepts. I agree with the lady in the room who earlier said, we don't talk about climate change in communities. We talk about change. What changes are you seeing? Yeah? And we get results that way. For us, even if you quantify the risk, we're laughed at in the community. We take storm surge modeling into the community and they look at us and go, so what, we knew about that? That was well known to us. Or floods, we do the flood mapping and they go, well yeah, that's known to us, so why did you spend all that money instead of coming to fix the problem? You know? So we've taken abuse for that as well. And even if we took these things in that they didn't know about, unless we're going in with a sort of solution to help mitigate or reduce the risk, what is the point? It's a lovely report. It's excellent, in fact. It looks great on paper, lots of bells and whistles. But how does it actually reduce risk in the places that are at risk? So we've tried to combine some of these good studies with early warning systems. And we found that we have flaws there as well. One of it is, for example, in Puerto Rico some years ago, they had an excellent early warning system which alerted the center, and the center alerted the communities, and everyone went up country for Kings Day, and the telephones couldn't reach them. And no one could issue the warning, and people died. We have, for example, NOAA talks, National Hurricane Center talks to our meteorologists, and they decide on when the warning should go out, and they come out on our radios, and our Met Services issues them to radio stations. And all the radio stations today are digital. So there's very few people to actually receive the fax warning or the email warning that comes from the Meteorological Service to broadcast it. And even if they could, many of them don't do updates on a regular basis. So the warnings don't go out in time. So we have issues with stuff like that. That's great stuff, but it just doesn't reach where it needs to go. And then we do have technical studies. For example, the Seismic Research Unit of the University of the West Indies has produced some really good volcanic hazard mapping for the region, which helps us to do planning in the future. The water resources agencies in Jamaica and Trinidad have produced flood hazard mapping, but they use it to establish the datums for the flood gauge boards that they put up in the community against a mango tree. And that way the community can then take charge of the warning themselves. And they can decide when it is time to leave and evacuate. What we do in the community, therefore, is what we might nickname, since this is a World Bank forum, I thought I'd introduce an investing term, value investing. Because communities have great intrinsic value. They don't produce a lot of gain in the early stages that you can shout about. But in the long term, the dividends are great. You know, the long-term gains in the community are excellent. So for the Red Cross in the Caribbean, we have a disaster management strategy that runs till 2014. This year alone, that very simple strategy is going to hit 50 communities and reach about 75,000 people. And we're not doing it by scaling up our operations to become big institutions. We're going to do it in partnership with people who are already working in the field. So all our Red Cross societies, from the Finnish to Japanese, Norwegians, and also the Caribbean Disaster Emergency Management Agency, and it's the national disaster officers that work with them, we're working with them. So we want to make sure that the little money that we have goes a much longer way. This works for us because at the end of the day, we've found that 2 years on, the communities that we've trained are actually still getting involved in risk reduction, and they're still getting involved in helping their neighbors, just recently in Dominica and also in Antigua. So we call it small initiatives because there's nothing fancy about it. In fact, it's downright you have to get out into the field and not in the nicest parts of Antigua or Barbados where all the tourists see. We go in the back where all the staff who work in the hotels live. And we help them by letting them do the work. So they're the ones that do the risk assessment. As Daniel says, it's not going to be academically rigorous. This vulnerability and capacity assessment is for them. Help communities understand their risk. Sometimes they already know it, sometimes they rediscover it. What we do out of that is we ask them, knowing the risk, to come up with their own solutions to that risk. So we do micro-projects and we fund those micro-projects. The micro-projects then are very small, 3,000 to 5,000 US, but the micro-projects actually deliver a risk reduction within the community. To make sure that they have a first response capacity, we also train them in first response, search and rescue, first aid, opening shelters, etc., so that they can help themselves long before the authorities get there. The big impact for this is that because the community does it themselves, that we don't go in there and do it for them, they actually take ownership of it. It's theirs. Even the report's theirs. We give it to them. And therefore, they buy into whatever the strategy is for reducing risk in the community. The nice part about this is they don't only produce risk reduction strategies for small projects, they actually identify some really big projects that need to be done as well. But they just don't have the capacity on their own to do it. And these are costly, long-term projects. So what we find is that if we can get communities to stop waiting on government to do the fix and someone else, they actually get up. And once they see success in one way, we found that we have communities who are then poised when elections and other things come around to say, oh, what do we need? Well, it's funny you should mention it, because we have this report here, and we need this. Yeah? So they're in a better position to advocate for what they need. The good part about this for us, too, is that we don't just have disaster management programs, we also have health programs, and we have climate change adaptation programs. And we found that we've discovered saltwater intrusions, we've discovered coastal erosion. The community doesn't know this is climate change. They don't care. They don't care what you call it because it's affecting them. And so we're able to then start looking at those issues as well out of the research. We're able also to use these same community members to help educate their neighbors in health issues. So for example, when H1N1 came around, it was these community teams that went door to door to help their neighbors learn about what to do to reduce the risk. As I said before, it's a small initiative. It doesn't pay off right away, but it does have great gains. And it has to be done in partnership. We don't think in the Red Cross we can do it alone, so we have to do it with other people. Thank you very much.
Good afternoon, ladies and gentlemen. My name is Edmond Azaryan. I am from Armenian Red Cross, and I would like to share with you some experiences of community level hazard and vulnerability assessment, which we used to do for supporting communities, as I titled my presentation, to become more safer and resilient to disasters. The method we used is called Vulnerability and Capacity Assessment, which was developed by International Federation of Red Cross and Red Crescent Societies and is used by national societies since 1995. The idea was to simplify this risk assessment, like risk, vulnerability, hazard definitions, and to make it acceptable for locals, for people living in the communities, and to make them realize what is going around them. I will present the methodology, how we implement this assessment, and what are the main outcomes from this assessment. The idea of this assessment, this is not just to implement the assessment and develop some report for the communities, but this is to stay with them after even implementing this assessment and to support them in their capacity building, in their preparedness, and in their awareness raising and mitigation initiatives. And that's why I call the disaster preparedness and mitigation based on the VCA results, what we do after these assessments. There are 5 approaches within the methodology. This is the mass survey with inhabitants. This is the individual and structured interviews with key persons within the community. This is a focus group discussions, or in some cases workshops. This is hazard mapping, stakeholder mapping in terms of their projects and activities in a region. Why in a region? Because we consider communities somehow left alone, and the only area and only stakeholders which they can expect some support or integration into their local activities, this is stakeholders at regional level, and like they never expect something from national ones. In terms of mass survey with inhabitants, we have developed special questionnaire for inhabitants and for key persons, which we use to together to collect information from community inhabitants on the context where they live, on their vulnerability, on the hazard level, and on the local capacities. As you see from the presentation, we always try to keep the balance between the gender. And usually this is like 50-50. It's not common too much for Armenia and for like maybe for most developing countries to involve women in such an activities like civil society activities, but we are trying to encourage communities to involve more women into civil activities and to pay more attention in the integration of women in their community life. And during this mass survey, we filled the special questionnaires and we organized we opened some discussion with the people. This is not just a checklist where we are asking questions and putting yes or no. We are discussing with them. We are explaining all the questions, and this is also helps us to reach more people and to attract their attention on the issue as much as possible. In terms of individuals as a key persons, we identified as a key persons at community level the heads of communities, the deputies, heads of communities, special technicians working in the community, the head of medical center, headmasters, and school administration. These are the people whom we work and consider as a key persons, considering that their knowledge and perception on risks and capacities and local context is more higher than ones of the inhabitants, and their way of thinking is also a bit different from individuals. Focus group discussions or workshops. We do it. We gathered some 20-25 people in one area and opening the discussion with them on the vulnerability level of the community and the hazards threatening them. And this is always we are trying to collect people from different groups, from considering the age, gender, and their social and economical conditions. Hazard mapping. This is not the scientific or technical mapping as we saw during last presentations, but this is a simple mapping which helps us through our direct observations and examination to capture the community, the whole community, its location, the risky areas of the community, the main infrastructures, the neighboring communities, and it looks like this. This is this is a map developed for one of our communities in Tavush region, and ideally, when we do it, it was assigned just for our use and for our donors and stakeholders. But when the community leaders really asked us for providing them with this map, saying that they haven't such a practical map which shows clearly all the risky areas and the hazard-prone areas and the infrastructures which are under these areas, we decided to develop digital version of these maps and to provide them as an annex to the report which we developed based on the results. Stakeholder mapping, as I mentioned already, this is the hope at local level to receive some support, technical and financial. That's why we are trying to map who are the main stakeholders at local level who are dealing with disaster risk reduction and other areas dealing with disaster risk reduction. The main outcomes of the assessments, I mentioned three different points because we did different projects, one for UNDP, one for GTZ, and for IFRC, and now it's running with DIPECO. The difference is that, according to the objective of the projects, the final product was different. Like for UNDP, the final product was to define the most risky communities, 40 communities from 94 assessed, and then to develop detailed disaster mitigation and preparedness activities per each of these communities. Like for GTZ case, it was the provision of general recommendations for national, regional level governments, for stakeholders. And like in the case with Federation and with DPECO, we are developing detailed plan of action for disaster preparedness and mitigation. And we don't do this alone. To ensure the ownership of regional authorities, of local authorities, and like LEMA, we involve them in the process of development of this plan of action. And the idea is to guide them, to give them proposals, what are the main activities should be implemented in terms of risk assessment and analysis, preparedness and mitigation, showing the timetable, persons in charge and partners whom they can work to reach the results. And at the end, I would like to show how we link this VCA, this assessment, with disaster preparedness and mitigation. And usually we build our projects not just for assessment, but assessment is the first step of our project, and we follow based on the assessment results. And we, according to our present experience, we form community preparedness and response teams. We establish such teams. We support communities to select the team members. We support communities to organize special first aid trainings, basic rescue assessment trainings, and then we encourage these teams to become an advocacy tool within the community and to advocate for their needs and for their protection. The other component, this is contingency planning, where we are supporting communities, and as a Red Cross, we have developed jointly with GTZ special guideline on disaster management planning and provided to our beneficiary communities to revise the existing budgets and to make them in line with international standards as well. The legislative advocacy, the trainings and drills, and fostering of mitigation activities. As a Red Cross, we haven't any practice of providing special funds for mitigation activities for communities, but anyhow we are supporting them in developing like micro projects, and we are supporting them in fundraising for these micro projects. In terms of legislative advocacy, I would like to highlight that we are fostering communities to include in their community annual budget special line for disaster risk reduction. According to the legislation of Armenia, there are only two sources for state funding. This is governmental annual budget and community annual budget. As far as we are a community-based organization, we are concentrating our efforts on communities and trying to encourage them to include this line because it's absent, and to have special money within their annual budget for disaster preparedness and prevention for their communities. Thank you very much.